Greetings. I am Tanya Abreu, and I am absolutely thrilled to be here to record another episode of the Rethink Your Health podcast, finding new, often unexpected ways to wellness. Today, we have a topic and a guest that will literally blow your mind, blow your ideas about the inevitability of pain in your life right out of the water. You know, the pain industry is $1 trillion industry. Chances are, if you live past 50, and you're lucky enough to do that, you will have some sort of chronic pain episode. Whether it's one morning that you wake up with searing pain down your back and leg, or a kind of slow buildup of tennis elbow or golfer's shoulder or dancer's knee, or any of the other hundreds of things that can cause us to wake up or live throughout our days uncomfortable, sometimes so uncomfortable that we turn to things like opioids that we know will destroy our life just to find some relief. Today, I have the distinct pleasure to talk to Dr. Ramon Nunez, who has dedicated all of his career, well, I know he was a police officer for a little while, but decades, to solving pain for thousands of people, not just pain management, but pain resolution, actually resolving the pain, releasing the pain from your body. So, with great excitement, I'd like to welcome Dr. Ramon Nunez. Greetings.
Hello, Tanya. How are you, darling?
I am very, very good today. And actually, I have a pain free day. Yesterday, before yesterday, I had gone to the gym. It's a good way to do this. And I had
Hmm.
started doing this new type of strength training. And I can't remember the words. I remember how to do it, which is you take the absolute heaviest weight that you can and you lift it for just a brief, like 30 seconds,
Hmm.
so that it is to the point of, oh my God, I really can't do this. And you let it go. And you do that just a few times, no more than a minute total. And then you walk away and you give yourself a day to recover that muscle group. And I did that for back and shoulders. This is something I learned in the whole Tony Robbins life force thing, and I can't remember what it's called. But I did wake up yesterday with, some, oh my gosh, these muscles do need to recover. And I only worked out, literally, I only worked out for a minute. Now, that is acute pain. That's not chronic pain. I
That's
know
right.
it's going to go away. So let's start today's episode by asking you to define the difference between acute and chronic pain. And is it actually physiologically different somehow, Ramon?
Well, the answer, of course, is yes. It's different. It has to be different by virtue of what you just said. There's acute pain, which can last. What's acute pain? You stub your toe in the middle of the night. It hurt. That doesn't seem cute to you, but that's acute pain. Okay, and will it last till morning? Possibly, but by the end of that day, it's gone. Okay, no harm, no foul. Now, let's say you stubbed that toe and you did it again 2 nights later. Okay, now that pain, is it still acute? Maybe it lasts a couple of days. Still acute pain. Your body resolved it. Acute pain, the body heals and it heals it just fine. There was no real tissue damage. There was no real nerve damage. Resolves easily. Chronic pain, that's a whole different story. Okay, with chronic pain, people often think, oh, well, it happened after a really bad accident. Okay, yes, perhaps you're in a motor vehicle accident and you suffered damage. You suffered tissue damage, muscle damage, nerve damage, perhaps broken bones. Okay. Now, that pain's not going to go away in 24 hours. It's not going to go away in a week. That pain may last 3 months, 6 months if you're doing some rehab. But we expect at that point, that pain should resolve. Ultimately, if we are, as I say, self-healing, then if the doctors did their job and they sewed me up and stitched me up and glued me up and did whatever they do, thank God, and I healed properly, then I shouldn't have chronic pain. Except that that's not what happens. Patients over 40 years of practice would come to me and say, well, I have this pain in my wherever. How long have you had it? Oh, it's been 20, 30 years. So I'm thinking, okay, now what happened 30 years ago? And then they begin to give me their history. Oh, well, I was in this car accident, or I fell off a ladder, or I got beat up, or whatever the situation is. And I have to sit there and say to myself, wait a second, you're telling me that an injury that occurred to you 30 years ago is still giving you pain? I say, no, that's not it. It's not the injury. The bone healed, the tissue healed, the muscle healed, the nerves, all that healed. Okay. But what's left behind? Often a dysfunctional state. Okay. I like to think of it as, when you're in pain, do you do everything the way you normally do when you're not in pain? No, you move a little slower, you hesitate, you don't move in the same way. If you injured a leg, you may limp. If you injured your back or your hip. So, in other words, you'll modify what? Your behavior. You'll modify what? Your programming. Now, most of this occurs automatically. I injured my right foot, I'm going to limp. That's normal. It's protective. That's fine. But what happens, again, those 6 months, those 9 months later, when the pain is still there? Well, in my opinion, you rewrote a program to protect you when you were in pain, and now you haven't changed that. You didn't fully recognize your change in behavior, so you didn't improve on that behavior. Perhaps you are glad that the pain is gone. Now, I'm not limping as much. You may not realize you're holding your muscles a little differently because your brain says, look, we can't continue to limp. So once again, what does it do? It attempts to modify your behavior by modifying the program in
All
your
right,
brain.
I'm gonna stop you for a minute because I think it gets a little bit complicated. So what you're saying is chronic pain can be attributed to behaviors that we adapt around some kind of acute pain or something that happens to us, and
Yes.
then our body is whacked out of balance, and just gets used to the way it needed to be for a short period of time. It just continues. Why is it? Why would it be not that bright?
Well, what the beauty of it is that it is that bright if we pay attention. Most of us, we injure ourselves, we adapt our behavior for a period of time until the pain is, ameliorated in some way. And then we go back to whatever our behavior is in that moment in time, whatever it is. We don't think about the fact now wait a minute. I remember now that I injured my knee doing this. So maybe I need to reevaluate how I was doing that, whatever that was. Okay. As opposed to just ignoring it because why? Well, the pain, it doesn't hurt anymore. Oh yeah, my knee doesn't hurt anymore. Yeah, my left hip's a little odd, but my knee doesn't hurt anymore, and it's not enough to cause me to change my behavior. It's not enough to cause me to rewrite the program. And why is that? Well, think about this, Tanya. Most of us, unless we're pursuing a health science-based career, how much do we really know about our bodies?
Mhm.
It's not like it's taught in school, really. And so it presents itself as well. If you're injured, if you're ill, if you don't feel right, go to the experts who will take care of you. except that my experience tells me the experts know a lot less than they think they do. Okay. But where do we turn if you're not a physician, if you're not a healthcare practitioner, and you have these problems, whatever they may be,
Mhm.
and you're not getting help from the norm, from the medical establishment? What do you do? Well, number one, you suffer. Okay, you're in pain for whatever that period of time is, or as is quite common, you seek out alternatives when you hear about them. Well, I heard about acupuncture, or I heard about chiropractic, or I heard about naturopathy, or I heard about herbs. Let me look into that. And some people will do that. Okay. And sometimes that's helpful. Sometimes it's very helpful, because what does that do? That provides perhaps a different viewpoint. Remember, it's not like, you know, Western medicine as an organized system of healing, if we can call it that, has only been really effective in what, the last 150 years, maybe? And that's stretching it, I believe. But meanwhile, we've been on this planet a lot longer than that, dealing with the same aches and pains, excuse me, with the same problems, with the same issues of illness. And somehow we've managed to figure it out to a degree that we continue to thrive and survive. Even in the most underdeveloped nations, they're still having babies. People are still existing. Okay, so we bang our heads against the wall, and we go to the Western physician, who does what? Tries to fix the problem, but really doesn't educate you on the problem. And remember, they're trying to fix the problem from their perspective and how they understand it. The problem with that is that, Western medicine it continues to grow, and is incomplete. And until they're willing to look at what else is out there and perhaps understand illness and pain better, things aren't going to change. And so,
I want you to explain something, because I've heard you talk about this before. And before we talk about Western and Eastern, and you are a doctor of Eastern medicine, and have practiced that. But you said something, and you said that, and I'm going to put this up on the screen, and that is, you said before that pain is a state of muscular contraction.
you know, I started my education in medicine and healing as a continuation of my martial art training. Okay. And one thing I learned through practicing martial arts is how to defend myself. Okay. And if you think about this, any organism, when under stress, whatever that stress is, whether it's environmental, emotional, physical, to protect itself, what does it do? It relaxes completely and stays at ease. No, it contracts and either prepares for battle or prepares to run, but it doesn't relax, because that is the action of the organism, the brain, and you as an organism, to protect yourself through what? Through contraction. Okay, what do you contract? Your nerves? Well, you can't really contract your nerves. You contract your veins and arteries. Well, you really can't contract. The only thing you can really contract are your muscles. And guess what? You're more muscle than you are anything else. And so, but what happens, and see, this is where SFT really, really shines, I believe. And that is an understanding why a muscle contracts, which we know it contracts if it receives an impulse. Okay, great. So we know we have a limp muscle, give it an impulse, external or internal, and it contracts. In and of itself, once the stimulus is done, that muscle should go back to neutral. Okay? But that's not what happens, unfortunately. What happens is, oh, well, I injured myself. I have to protect that injured part of my body by contraction. And over time, you would expect those contractions to fully relax as it healed. No, maybe it stayed 10% contracted until the next time you injure it. Now it stays 20% contracted. Now, as a result of that, I move my head differently, or I use my ribs differently, which means I breathe differently, which means I walk differently.
And
Okay.
all of the muscles, one muscle from that childhood song, this is connected to this, is connected to this, right?
You know, I remember teaching a program once, and I was describing to a group of participants how a simple thing like a sprained ankle could cause tens of thousands of dollars in diagnostic workup for heart disease. And they're looking at me like, what? And I said, well, I'm going to give you an example of multiple patients that I experience this with. You get someone who maybe in their early teens, a young woman sprains her left ankle, okay? And it healed theoretically, but for the longest time, it hurt. Now, she goes on in life, 20 years later, that ankle never really quite, felt right. It always felt tight, which changed your behavior. Perhaps you didn't participate in the kinds of activities you would have wanted, or perhaps you choose not to walk as much as you would like, or you choose to not use stairs, even though it may be more convenient. Okay, so are you still there, Tanya?
Yes, I was just giving you the screen. You're
Okay,
passionate.
no, I said because I'm missing you. Okay, so so in this one particular patient, that sprained ankle led to a bad knee, right knee, and so she protected it. It led to deconditioning because she wasn't physically as active as she could have been. Okay, it led to weight gain. It led to emotional depression. Okay, but what else did it lead to? It led to a contraction of blood and circulation. Okay, remember, the blood moves down the body and tries to come up. Try pushing that blood through an inflamed ankle that never went back to normal. It always stayed somewhat swollen. Okay, well, then that has to push. That means your heart now has to beat harder to push through tight muscles, tight ankle, tight knee, or a tight hip, or a tight shoulder. Okay, well, the heart is a muscle. Working harder is exercising that muscle, except that you're working the left side more than the right side. And now you have what they call, cardiac hypertrophy, enlargement of the heart. Okay, so what started out as a sprained ankle that was never fully quite resolved could lead to heart disease. Okay, and I had literally 3 different people in that class tell me, I know someone that went exactly through that. My sister or my sister-in-law or my brother. And they're like, how did you know? I said, well, no, we just follow the pattern. Okay. But here's, I guess, my
Well,
issue.
I'm gonna be what's that called? Like a novice here, a
Yes,
non-professional, right?
absolutely.
Okay, so and this is kind of really cool because I'm taking notes, and this was one of my notes. You talk about tight feelings, like somebody's ankle was tight. But I know that I've heard you say that stress is a source of pain, emotional stress too. So I just said tight feelings physiologically in your body and emotionally, like here in your heart, cause pain, which causes this contraction, which ultimately causes disease, meaning, so I'm contracting my whole body, which means my veins and arteries and my heart is an organ is contracting. My skin is an organ, it's contracting and wrinkling. I mean, it's crazy how it can be so powerfully holistic approach to pain, Ramon.
Oh, you're going to love this. Understand that during all of this, when your muscles are tight and your blood and your veins and your arteries and your nerves and all of this is going on, think of whatever you want to define as your engine. What is your engine doing? And we can look at that engine and say, well, the heart's an engine, or this organism. No. We can go right down to, to the cellular level, to the mitochondria, and say, what is the engines of your body doing? In many cases, they're having to function more than is necessary.
Hmm.
Okay, and what is the result of excessive cellular activity?
Inflammation.
Inflammation, oxidation. Okay, oxidation leading to hardening of the arteries,
Hmm.
leading to hypertension, leading to heart disease, diabetes. So you start to see how, look, the foot bone really is connected to the neck bone. And I would say, and the foot vein is connected to the neck vein, and the foot nerve is connected. They're all, we're all connected. Until physicians of any ilk can take a part of your body, fix it, and put it back, okay, we're not there yet. We've experimented with hearts, but we're still not there yet. We need to begin to have conversations. In my years of practice, I have studied as many, for lack of a better term, holistic or alternative methods as are out there. Okay. And I've been fortunate enough to have worked within Western medical systems as well. I worked for a major hospital system in clinical practice, and I've had my own practice. And I've trained practitioners, physicians, nurses. And so I've been able to develop a better understanding of how we function and exist holistically, as you said. And if we think of all practice of medicine and healing as being holistic, a lot of the questions that Western physicians have start getting answered. A lot of questions that alternative practitioners have start getting answered. And I think we can ultimately, my hope is, whittle this stuff down to what really works and why.
Now, I'm
And
going
if
to stop you a little bit for your credentials because you mentioned working at large medical centers. So, your background, we know you're a sensei. We know you have a lot of experience in Eastern medicine, that you're an acupuncturist, that you have studied and embraced all what we call alternative or complementary medicines. But talk to us a little bit about. I know what's very exciting is that you're right now on the cutting edge of being able to perhaps offer chronic pain management mainstream to people who are sitting home right now with osteoarthritis pain that keeps them in a chair. And so,
excuse me,
where did
Tanya.
that come from? How did that? Where did you train?
Okay, can we hold for 30 seconds? Be right back.
Okay. So this is kind of mind blowing, guys, right? The idea that inflammation is caused by pain. We know that inflammation is now being proven to be at the root of cancer, diabetes, heart disease. So if we could learn to control our pain, to control the constriction of our muscles, to control the constriction of our emotions and how to release that, we can find the keys to curing so much suffering in our lives and in the lives of people that we care about. We are talking to Dr. Ramon Nunez. We're going to talk in a few moments. He's the founder of Somatic Functional Therapy, and there he's back. And go ahead, Ramon, share what you wanted, and we'll continue on.
Okay, well, starting with martial arts, where it really started, I started training in the martial arts when I was 6 years old. Self-defense, judo, minor stuff. But growing up in New Jersey, growing up in Camden, New Jersey, excuse me, somewhat of a dangerous city, self-defense was very important to me. I'm 5'6", barely, so not outstanding in that regard. So I wanted to learn to defend myself, but I took to it, as some say, like a fish to water. The more I trained in the martial arts, the more I wanted to learn. Well, by the time I was 14, I was already a black belt and was beginning to learn that, wait a minute, there's more to training in martial arts than just kicking and punching not getting beat up and, beating other people up. And I was fortunate enough to start getting into the philosophy. I always liked to read. I was always buried in libraries. So I started reading and learning about things like massage, shiatsu, and acupressure and acupuncture. And it paralleled with what I was learning as a martial artist of what were mentioned as pressure points in the body to manage, control an opponent. And also as a black belt, you know, think let's think of an animal. An animal out there in the woods gets injured, it can't run to the nearest clinic. It can't go to the hospital. It has to deal with whatever the injury is, hopefully get well and move on and survive. Well, in martial arts, if you get injured, if you're injured in a fight, there's no timeout. Oh, I sprained an ankle. Let's fight later. No, you got to be prepared to deal, first of all, in spite of the injury. And second of all, if you're a warrior, you need to resolve that injury as quickly as is possible so that you can survive. Well, I continued in martial arts and got involved in studying what was called traumatology. What was traumatology? Traumatology was just that, learning to deal with a sprained ankle if it got sprained in class, learning to deal with getting punched in the face, learning to deal with, conditioning of your hands and how to protect yourself. And that led to my wanting to learn more about healing. So I started learning herbal medicine and studying acupuncture. And, we're talking back in the 60s, the 70s, okay? So that by the time I was, I don't know, 20, I had opened up my first martial arts school. I had started a small practice seeing private patients because I had enough students who knew enough people in pain and problems. And if they weren't having their issues resolved by Western medicine, or they couldn't afford Western medicine, they would seek out someone like me. Well, that led to my doing apprentice training. And I found myself apprenticing with some very well-known practitioners of acupuncture and traditional Chinese medicine and herbal medicine and manipulation and, again, massage, you name it. And it was at a time when, a lot of this was really starting to come back. It had been around before, but in the 60s and 70s, it started coming back, I guess, with a vengeance. So there was a lot of things available. I'm sure you remember quite a few of these things. But since then, some things have come and gone. Tons of money have been spent on research and study with very little to show for it. Okay. Having trained in acupuncture, having treated thousands of patients, manipulation, again, nutrition, the whole 9 yards. I was always looking for, okay, what's the common denominator here? Patients would tell me, well, I've been to a chiropractor and it helped or it didn't help. And having, been treated by chiropractors, it helped me tremendously. So I'm going, well, wait a minute. If it helps me and it makes sense to me and it didn't help you, why didn't it help you? There were other issues involved. I know many patients, I've trained many chiropractors who will tell you, oh, they go to their chiropractor religiously every week if they have to. And part of me says, that's great. You're taking care of yourself and responsible for yourself, but why aren't you getting well? Why do you keep having to be retreated, shall we say? And in searching for that common denominator, what made the most sense to me is that, number one, we're self-healing, okay? We heal. If you cut your finger, does it truly matter where you put a Band-Aid? If the finger doesn't get infected, you can put that Band-Aid on your butt, that finger's still going to heal because it has nothing to do with the Band-Aid, okay? And so I'm thinking common denominator here is us, okay? We heal. And so then I think, okay, we can support healing or we can interfere with it. What would you choose? Well, I want to support it. But how do you do that? How do you support healing if you don't know how to support it? How do you not interfere with healing if you don't know how to not interfere? Okay. Once again, I started thinking, how do we provide to the body, to the organism, to ourselves, to you, what is necessary for you to heal? Okay, well, we know food, you need good food, okay, good nutrition. You need physical activity, okay. Obesity is at a whole, the highest it's been ever in this country. Why? Because people aren't moving as well as they should or could be. Part of that is obesity related, but part of that is pain related. Okay, what does it matter if I say to Jane Doe, okay, I need you to start exercising to get in shape. A good goal would be 2 miles at a time, and they can't walk 50 yards because of pain. And so it doesn't matter what I recommend. So I start thinking, okay, in my alternative practice, the majority of patients seeking me out were more often looking for pain relief. Okay? And I have to say, for the longest time, I was very good at pain relief. But I was frustrated again by having to see patients 20 times, 30 times, 40 times. Well, according to the literature, my training tells me it should take, 5 trials of therapy at 12 to 20 sessions each trial. Number one, who can afford that? Okay. Who can provide that? And is it working? I came to the first conclusion, no, it's not working. Okay. There's not enough acupuncture in the world. There's not enough herbal medicine in the world. There's not enough chiropractic or osteopathy to resolve these problems if we don't really understand what healing and illness is. Okay? And while conventional medicine wants to lay claim that they have an understanding, no, they don't. They don't. If they stay in it long enough, they realize you're right. We don't.
Now, wait, I did recently hear a definition that I wanted to ask you about. The pain is a brain response to um, nerve endings sending a signal to the brain. That's simple. Now, you're saying, of course, when you get cut, your nerve endings say, ouch,
Mm-hmm.
right? But when you're saying the chronic pain, those nerve endings are coming from muscles that are being held uncomfortably over tons and tons of time. And they are sending the message to the brain of, yes, we're still in pain. Yes, we're still in pain.
If we understand that nerves are not really separate from muscles,
Okay.
only with a scalpel, okay, you can separate the nerves and you'll never do a complete job. Nerves are embedded within the muscle. They're part of the muscle matrix. And remember, we're made up of muscle. Now, we'll use any muscle, doesn't matter, but say a muscle was in contraction. In a unnecessary, habitual contraction. Unnecessary is if it's in a 50% contraction when it only needs to be in a 20% contraction. Okay, that's an unnecessary state of contraction. Or it's habitual, it's as a result of a habit pattern created by either poor behavior on our part
Even
or,
posture, right? Even posture.
well, this is it exactly. Okay, when you see a model shoot, and they're in these ridiculous poses to try to look better. Yeah, try holding that same pose for 30 minutes and you're going to be in agony. But we should be able to assume any pose or position for a short period of time. But if it becomes habitual, meaning that the brain is not connected, brain, if you went to bed tonight as you will, and tomorrow morning you wake up and your hand is sticking up in the air, you're going to ask yourself, what's going on here? Why is my hand up in the air? And you're probably going to quickly put it down. Okay. Okay. What if you went to bed tonight, tomorrow when you woke up and your hand is up in the air for whatever reason you didn't notice? How long would you be able to hold that arm up? Well, we don't know. It's based on whatever. And what's going on while holding that arm up? Well, other muscles are in states of contraction, keeping you in that position. Well, how about you'll say, well, that's ridiculous. I wouldn't walk around with my arm held up. No, but you may walk around with your shoulders up halfway around your ears. Or you may walk around with your, and I don't mean you personally, but I mean people in
No,
general, with
no,
their
but I
head,
do, so I can
with their
relate.
head anteriorly forward. It's not that your head fell into your lap, it's that your anterior muscles are pulling your posture forward. Okay. And it's constant. Okay. So let's go back to the muscle. You now have a muscle that is being squeezed. Now, that squeezing is causing what? It's causing a restriction in blood flow.
Mm-hmm.
Okay. It's causing a restriction in nerve conduction, nerve impulses going to and from the muscle. And if you remember that nerves are there to carry information. Okay. But what happens if the information isn't getting from point A, let's say here, to point B in your brain? Okay, now your brain has to create a whole other script. Why? Well, because it's not getting the relevant information that it needs. And so in order for you to survive, it will rewrite the program. Okay, this is what some of the latest research is showing, how the brain is so malleable, it creates new nerve pathways. It does from the moment of conception to the day we die. It's constantly creating. Okay. But these new pathways are, number one, going to find the path of least resistance, and it's going to find the path that it's able to find. How well will it move through muscles in states of contraction? How well will it move through disease organs? How well will this information travel back and forth through a dysfunctional body? Well, some of it may travel just fine. Most of it will not. And that's the information that your brain has to work with. Okay? And so we say, well, I remember when I could A, B, C, or D, do whatever. And now, for whatever reason, I can't do it. Okay, well, at some point, you may have stopped doing that. And so your body had to rewrite that script. And so it had to modify what you're able to do based on what it perceives you're able to do. Okay? This is why, as a martial art practitioner, I'm 69 years old. Now, does that mean I can do the things I was doing in my 20s? No, but I'll bet you I can do things that most 50-year-olds can't do. Why? Because I've been able to develop my body and the feedback brain necessary through these nerves to these muscles to allow my body to heal.
And I think that I want to add relax too, because I keep hearing in between all of your sentences this idea of the opposite of constriction, the opposite of pain is relaxation and peace and calm. And that seems to me, and I put up on the screen, we're talking to Dr. Ramon Nunez. He's the founder of Somatic Functional Therapy. We need to get to that. Stop and tell us about where somatic functional therapy took root as a kind of science and discipline, where doctors and nurses began to really connect with you and you began seeing clinical research results.
Somatic functional therapy refers to, first of all, somatic. Somatic, as I use it and as it's been defined, pertains to your body from your internal perspective. People see you, Tanya, you look great, you look fabulous, everything must be going great. Oh, you got the rope, by the. But that's not necessarily the program of what's going on in your life, but you present what you present. Well, you have your somatic perspective of your life and how you function. Okay, well, in the martial arts is a somatic system of learning. We learn through sensing, through feeling, through reproducing an action. In 1975, Moshe Feldenkrais, who was the creator of the Feldenkrais system, came to America and was lecturing. And I was fortunate enough to be in the right place at the right time to listen to him lecture. I was initially not interested in his work as a body work practitioner. I didn't know anything about it. I knew of him as a judo practitioner, as a black belt in judo back from the 1940s. Curious enough to seek him out when I was there, and I stumbled on this system of body work that he had created. But Moshe Feldenkrais was, from a totally different generation whose training gave him a perspective that while he could perform some amazing things with patients, in my opinion, I don't think he was able to present it as well as others have since then. Well, of course, others have learned more as we've gone on. So one of his students, who I became acquainted with, who sponsored him, Thomas Hanna, took Moshe Feldenkrais's work and further developed it. In studying with him and with the work he was doing, I looked at the somatic work that I was doing with my students and my patients, and again, trying to make more sense of it. Moshe Feldenkrais, he died back in late 70s, 78 as I recall. Thomas Hanna was killed in a head-on collision in 1990. Okay, so it's been quite some time there. But during that time, many of the people influenced by these two great teachers have gone off on their own, and they're picking up on bits and pieces of understanding what somatics really is. Okay, somatic functional therapy is an educational therapeutic system. What do we mean by that? It's about teaching you how to use your body in a better way to improve your health. It's not just, oh, well, let me show you how to throw a kick. How about if we can show you how to throw that kick? But how about if we can show you how to do it painlessly, how to not affect your hip, how to have it not impact your neck, or teach you how to walk in a way that doesn't further aggravate your existing knee pain, okay, and actually helps you resolve that knee pain by teaching you how to sense from a somatic perspective your body. Okay? Because remember, unless you're pursuing some type of health career, most people come out of high school and college and even graduate school knowing so little about their bodies that we're left with no other choice but to go to a physician who, unfortunately, doesn't really tell us very much. Take this or get this procedure.
Prescribe things that mask the root of the pain until, the one thing I've learned through the years is that the body doesn't give up in its warning system. So you can take opioids and build up a tolerance to opioids, but if the body is still sensing that something is really off, it's going to keep throwing out pain signals no matter how much you use.
and it's going to keep trying to modify your function and behavior to help you survive. Because, I'm always amazed. You mentioned very early that I used to be a police officer, and that's true. I was 21 years old, but I remember seeing people in the street who had zero access to healthcare, horrible diets, alcoholics, and yet some of these people were 60, 70 years old, and you go, they've been this way for 40 years. How do they continue to live? And that's how capable we are to healing ourselves.
That's very, very powerful, Ramon. Tell me, because our time is running here. Tell me about your work at Henry Ford. Very conservative, very
You know,
traditional academic
Henry,
medical system.
Henry Ford Health System, the largest healthcare provider in Southeast Michigan. 20 at the time I was there, 26,000 employees, multiple hospitals. And in 1981, no, not 81, in 2001, good Lord. In 2001, I had retired from practice where I'd been in Kansas and moved to Michigan. And by weird coincidences, found myself hired by Henry Ford Health System in their first attempt at opening up a center for integrative medicine. The Henry Ford family of Ford Motors donated $1 million to fund a center for integrative medicine, and I was hired before the center even opened, while they were still under construction, uh, as to perform acupuncture and whatever I do. I was the senior practitioner there. In fact, second employee hired, and they opened up a beautiful facility where we employed, myself, of course, uh, psychologists, counselors, hypnotherapists, chiropractors, massage therapists, Feldenkrais practitioners, nutritionalists. And this was at a conventional medical facility, in addition to access to the entire Henry Ford Health System. In fact, right next door to us, sharing the floor, is their physical therapy department. And I was hired and I did what I do. I was seeing patients there. And one of the doctors there, the co-director, Dr. Alba Rodriguez, had created a survey system, data collection system, because one of the things that we wanted to understand is, okay, we offer all of these services. What works, what doesn't? They're a conventional system. They don't necessarily want their reputation smeared by an alternative center, but hey, let's face it, they had $1 million to play with. And so one of the things they wanted is, well, what's working, what isn't? We were seeing a lot of patients for a lot of problems. And as Dr. Rodriguez would tell me, one of the things that stood out was that while many practitioners were seeing patients 10 times, 20 times, 30 times, 40 times, one practitioner up to 150 times, these patients kept coming back, but they weren't really getting well. Okay. And what she noticed in doing the data collection were that I was seeing patients 4 times, 5 times, maybe 6 times, and they weren't coming back. And they were thinking, wait a minute, is this guy so bad they don't want to come back? Well, no, their issues were resolved. Therefore, they didn't need to come back. So being a scientist, her first question was, well, what are you doing that these other people aren't doing? And I explained, well, I do acupuncture, of course. I was hired for that, but I also do somatic functional therapy. And I explained to her what the basis of it was, what the theories were. And, it was interesting. And as fate would intervene, HAP, which is an insurance company connected with Henry Ford Health System, had recently announced an announcement for proposals for treating chronic low back pain. They wanted to see if they could come up with a new treatment pathway, a new protocol for how to treat chronic low back pain. And so many departments within the system, of course, sent in proposals and whatnot. And we decided, well, so will we. Well, we won the proposal. So all of a sudden, I went from being an acupuncture, somatic functional therapy practitioner to being a researcher with $1 million research grant. Okay, well, our first research trial did just that. It compared massage, it compared neuromuscular therapy, it compared chiropractic, it compared electronic acupuncture, it compared hypnosis and counseling, okay, that we all offered. It compared that to conventional Western medicine. So if you had to have surgery or drugs or physical therapy, and A third arm compared it to somatic functional therapy protocols. And the results, were ridiculous. We were so effective that the insurance company said, well, and our team suggested, look, we're effective for not just chronic low back pain after we proved our results. Our program is effective for, and we listed off a multitude of conditions. And so they allowed us to take that research money and deviate from the original intention and expand the programs we were offering. And so on the one hand, we said, okay, that's great, but in order to do what I do, we would have to train people in the way I do it, and I would have to train them, and that can't be done. So I said, look, I was doing stress management programs back in the 70s for nurses and teachers and police officers in group, hundreds of people. I said, I'm confident we can deliver somatic functional therapy to groups in a group setting. So we did an initial pilot with 100 employees at Chrysler, where we taught them what they needed to do. It was given to them as homework. So we would show up there for a 2-hour lecture presentation. They would be given assignments. They would come back 2 weeks later, having completed their assignments or not. All the data was collected. And at the completion of that, we showed a 55% resolution in back pain.
Say that again. You showed a
55% resolution in back pain.
Now, I'm going to interrupt you because as you know, Ramon, we've known each other for years. I have a disc that is actually, whether it was by accident, through trauma or not, actually kind of embedded into my spinal cord. And with a combination of somatic functional therapy and antioxidant supplementation, I have avoided surgery for 2 years, much to my surgeon's shock. And when I've been sitting all day, and I didn't sleep well last night because my AC was out. I tend to get some spasms in that area because the muscles go back into an old habit. So I'm speaking as a patient of SFT. They fall back into an old pattern, just kind of like a groove that they were in for years.
That's
and
right.
I can feel that happening. So while you've been talking, and this is now about hour 5 that I'm sitting without back support, most people would say, oh, put something around your waist and support your back. That's antithetical, because what that does is holds my muscles in the improper position. So what I'm sitting here doing is somatic functional therapy. I'm using my brain to micro movements, telling my back, just turn a little bit, breathe, turn back, turn a little bit more. And all it does is break the muscle patterns until I have full mobility and no pain. It's crazy. Anybody that's listening, I'm going to put up my definition, and poor Dr. Rodriguez, who will listen to this, and Dr. Joe and Ramon will probably squeal. But I really think that it's an educational system where we help our own brains reprogram the body to relax our muscles and to release the damn pain. And I use this almost as auto hypnotherapy when I'm going through emotional trauma. I can feel my emotional trauma in my neck and shoulders, in my gut. So I've learned to let those muscles go using what Dr. Rodriguez and Dr. Nunez have taught me through the years. Now, I know we have limited time, and I want all of you to be able to understand this. We can say, oh, look, 55% back pain. I'm, one of the billboards. Lots of people I know have gotten rid of chronic migraines, osteoarthritic pain, people who haven't been able to flex their arms for years. Leave Ramon in no pain. It is not, Ramon, it's not magic. It really is the power of your own brain to stop your own pain. And it's freaking awesome. Somatic functional therapy is Dr. Ramon and Dr. Alba and Dr. Joe Slikowski, who is an occupational medical doctor. in Boston. This is their organization, and it's about to go crazy, guys. And I would like you, if you're listening to this, to just go on to Somatic Functional Therapy and just subscribe to a newsletter that just will tell you when things really start rolling out. And also, you can do info there, you can email there if you have the desire to learn this. Ramon said, he was kind of old school and let's put a bunch of people in a room. Well, now we know we can put hundreds of people at a time on a meaningful Zoom, if not millions, but we'll settle for hundreds to get this word out there. I have to kind of slow us down and say goodbye, but Ramon, I want to give you just the floor a bit to really give people encouragement, because when you're in chronic pain, as I was, the kids still laugh about me not being able to lift a frying pan off the stove. I have an 11-year-old grandson who's with me, and he'd say, "Do I need to move that frying pan?" That's how my life was. I couldn't lift a fry pan. So you gave me not just the tools to solve my lower back pain, but you gave me another life. So encourage people. Those of you that are listening, somaticfunctionaltherapy.com. And we're going to go out with Ramon saying goodbye, and we'll see you next time on Rethink Your Health. Ramon.
You know, as I often comment on this, SFT, in my opinion, is almost the ultimate form of biofeedback. And what is biofeedback? It's getting feedback to your brain of the rest of your body, so that if that information gets to your brain knows what to do. And you can only learn that by learning it. You can only learn it by doing it. You can read all the books, you can see all the lectures, watch all the videos, but until you do it, then things begin to change. How quickly? Immediately. I
Yeah.
have seen patients get out of pain. I dare say, no, they say instantly, once their brain gets it. Your brain does not want to be in pain.
And once you train your brain, it becomes faster to do it. Like I said, I can do
Once you
it in 30
once you
seconds.
wake your brain up, you educate your brain, you teach your brain to sense what's going on and resolve the problem. This idea of we're going to manage your pain, we're going to manage your illness, nonsense. My goal is to teach you how to resolve it. We are self healing.
Mm-hmm.
Theoretically, every single cell in your body theoretically is replaced in about 14 to 18 months if we started with every single cell in your body under the right conditions. So think about it. That means in less than 2 years, you've literally replaced every single cell in your body. But if you replace it with the same old blueprint, with the same old problems, with the same old program, well, guess what? You're just going to get an older version of you wherever you are, continuing to break down.
Yeah.
But if we learn, we change it for good.
Instantly. The brain is amazing. Dr. Ramon Nunez, Somatic Functional Therapy. Everyone will be hearing a lot more of this. Please go to somaticfunctionaltherapy.com, subscribe to the newsletter. We'll also keep you informed at rethinkyourhealth.com. We have a blog that goes out. Thank you, Ramon. I
You're
thank
welcome.
you not
Thank
just
you.
for educating our listeners today, but for changing my life, one somatic micro muscle movement at a time. Goodbye,
There you go.
everyone. See you again soon. Take care.
Bye.